Hello everyone, I'm Dr. Pavithra, fertility specialist at GarbhaGudi IVF Center, Kalyan, Nagar. Today I would like to talk to you about endometriosis and fertility. Before going into endometriosis, I would like to tell you about the layers of the uterus. So the uterus is made up of 3 layers. The innermost layer is only the endometrium. That is what we shed in the menstrual cycle, followed by the muscular layer, which is called as the myometrium, and the serosal layer. So this endometrium, when it is present inside the uterus, that is normal. But when it is present outside the uterus on any other organ, then that becomes abnormal, and that is what is called as endometriosis. So how does it relate with fertility? So endometriosis, that tissue starts to grow on other parts of the organ. There are multiple theories why this happens is again a question, because this endometriosis causes a lot of inflammation in the body. So this inflammatory reaction is the response our body gives. So that is what affects the fertility. So when this endometriosis is present in the ovary, it is called as endometrioma. So it could be as a cyst as well. So this also we call it as chocolate cyst because of the brownish color which it gives because of the old blood which is present inside the cyst. So how does this impact would be that it can cause a lot of menstrual disturbances. It can cause dyspareunia, which means that pain while having intercourse, and it can also cause a lot of other symptoms like dysmenorrhea, which is again painful menstruation. Sometimes it could also be symptomless, that is asymptomatic, where these patients find it very difficult to conceive, not knowing any reason or having any other symptoms. So when it comes to unexplained infertility, a higher percentage of patients do get diagnosed at the end of it as endometriosis, which was probably a very mild form. So when it comes to endometriosis and how it's related to fertility, so as I already told you that when it affects ovaries, it causes the inflammation of the ovaries also. So it affects not only the quantity, that is the number of oocytes, that is the follicles, but also it has a very bad impact even on the quality of the egg. And also because of this inflammation, even if it is not present in the ovary, if it is present anywhere, like even in myometrium when it is present, we call it as adenomyosis. Again, it causes a kind of inflammation which again results in a lot of things which are not supposed to happen when there is implantation and other things going on for pregnancy related. So when this adenomyosis is present, or when it is present in any other part of the body, this inflammation itself causes immunological reactions which thereby do not allow the pregnancy to happen. So for these reasons, better to always get diagnosed, or rather better to always go for any symptoms, or even if there is no symptoms but you're trying for pregnancy and every other report turns out to be normal, then always keep it at the back of your mind that it could be a mild form of endometriosis which is causing a lot of inflammation in your body, and that is getting an immunological response, and in the form of which you're not able to get pregnant. Thank you.